Hello, everyone. Thank you so much for attending. I'm Dr. Brenda LaTowsky, and I am talking about combination treatments today. Now, listen, everyone, we know that in today's society, time just seems to be getting scarcer and scarcer, and your time is valuable. You want to be spending your time with your kids, with your grandkids, working, chasing your dreams. You do not want to be in our office frequently as much as we love to host you. So, I'm going to tell you the things that we can do together that are safe and even more effective when done in combination. Thank you for so much for attending today. Okay, guys, why don't we just have one treatment? Well, if there's one treatment that did everything, you would come in here to see me and I would offer you one treatment. Unfortunately, or maybe fortunately, my job is not that easy. We have a whole tool box full of tools, and we want to use what's in the toolbox. So one second here, technical difficulties. There we go. Okay, so we want to use what's in the toolbox. That's because aging is not just a unilateral process. We have volume loss, we've got loose skin going on, we've got fine lines that are becoming etched into our skin. We, of course, have sun damage, especially here in Arizona, especially those of you who spent your youth during the tanning phase, and we have uneven skin tone and texture. And so, unfortunately, we just don't have a one size fits all treatment for all of those things. But the good news is we have lots of modalities that will actually work, and we have several options that can that can that can treat these things. So we have several options to offer you, and one might fit more than others. So we're going to talk about that today. One second. Well, while we're pulling up the PowerPoint, I'm going to talk to you. Actually, this talk was inspired by a talk I did recently for our National Laser Society called ASLMS. And they asked me to speak on ASLMS about this topic, combining different treatments, and specifically injectables with energy-based devices. We're also going to be talking about combining various energy-based devices as well. And so basically, I pulled the science recently, like in the last 5 years or so. I pulled the science on what's published as to what's safe and effective. And so not only are these things safe and effective to do together, but their results actually seem to be synergistic, meaning they're better done together than spreading them out and doing them separately. And that might not be true for every single modality out there, but we know it's true for some things. So we'll go through some of that. All right, so one second here. Can you guys see the slides? They can see the slides out? Okay. Okay, awesome. All right, so here's your little house face. So think of your face as aging like a house. And so you've got your foundation, that's your bones and your structure. And then you've got your framework, that's your support. And then you've got your skin, that's the exterior of the house, the paint, so to speak, and the siding. And then, of course, you've got prevention, you've got your maintenance, which is daily care. So again, this slide emphasizes how we're using different things to treat different ways of aging. And then there's three pillars of rejuvenation. And again, most patients benefit from addressing more than one pillar. So we've got the structure, which restores support and lost volume. We've got stimulation that builds collagen, improves firmness. And then again, we've got the surface. So that's our paint, so to speak, improves the texture, improves tone. So we have to think of all of these as we're thinking globally about aging. Okay, so what do our aesthetics treatments do well? Well, you can see this patient on the right. She's had a diamond glow treatment. She has had some chemical peels and she's experienced an improvement in her texture. Look at the brown in her skin. It's dramatically improved. And look at the texture. See how she glows in the after photo. And so this is what we're going for. The texture, the smoothness, reducing pigmentation, sun damage, and then stimulating collagen production. That's pretty much the goal of all anti-aging treatments. So whether we're talking about chemical peels, lasers, some injectables, we're talking about collagen stimulation, and certainly for skincare. And of course, we want to improve overall skin quality and radiance. But the aesthetic, the very surface treatments can't replace facial volume, relax muscles that cause wrinkles, and address that underlying structure. So then we have Botox and its competitors. So what does a neuromodulator do well? Well, it softens these expression lines you see and prevents deeper wrinkles. So emphasize on prevents. So Botox is mainly preventative. And yes, it makes your skin look smoother and healthier. They just Hi again, guys. Sorry, technical difficulties. One moment. There we go. Sorry about that. So, so the Botox really smooths and it's very preventative, but it can't restore volume, tighten skin. And it doesn't do anything for the discoloration. Okay, and filler fills lines, lifts, does a beautiful job softening some of these creases on our skin and improving volume related age loss, but it's not actually tightening. And of course, it's doing nothing for the surface of the skin. So this is an example of what a biostimulator can do. And obviously, this patient's very young, but she just had a very, very small amount of Sculptra, which is considered a biostimulator. What does that mean? That means that it's injected and it stimulates your collagen to grow. Again, collagen is the endpoint of many of these treatments. And look at the radiance of her skin afterwards, and look at the very subtle restoration of volume, which makes her skin look more which makes her in general look more youthful. And of course, the radiance of the skin from the new collagen makes the skin look more youthful. But we don't have immediate gratification for this because we're waiting for the collagen and we're not significantly tightening the skin and we're not addressing the top of the skin. So redness, discoloration, sun damage. Well, then we have energy-based devices like laser. This is an example of Fraxel, and it is going to take off the pigment. So it will help improve pigment dramatically. So it kind of has that in common with chemical peels. It will stimulate collagen, so it'll improve the radiance of the skin. So it has that in common with chemical peels, the biostimulators, but also tightens skin. So it does a little bit more than the biostimulators and then the chemical peels. But if you look at her photo, which is quite dramatic, you see really nice improvements in the brightness of her skin, the skin texture, tone, of course, the discoloration, but she still would benefit from some volume. And so the energy-based devices can't replace volume, or they're not a substitute for Botox. So again, you see how these things start to complement each other and that a complete anti-aging package utilizes all these things. So you can see which treatments that we use for what. And in summary, aging doesn't happen all in one layer. We have all these different layers. Think of your house analogy. And we have to address each layer if we want to be comprehensive. So is this safe to do all-in-one treatment? So like I said, I presented this data to our professional organization. So I pulled some of these papers. Basically, the bottom line is we have science-based, peer-reviewed data showing that these treatments are safe when done together. And in fact, this recent publication done only in 2025 reviewed 29 studies. that examined the combination of these treatments and found that they're completely safe to do and the results may be do together and the results may be synergistic. Another study done in 2025 combining hyaluronic acid filler with energy-based devices. And patient satisfaction was extremely high and safety was perfect. 2021, this is a study studying the Fraxel combined with different modalities, no adverse events. 2021, this is RF microneedling combined with cosmetic injectables over a 4.5 year period, which is a really long time for a study. So it's a retrospective study. They're just looking for any unusual side effects and no documented AEs recorded. So this is all very reassuring that we can do these things together without without an increased risk of side effects. So here we see this little cartoon demonstrates when we combine treatments, we're acting in different layers of the skin, and that is responsible for the safety. So if you do want to combine treatments, I really want to emphasize, I can't emphasize this enough. You need to go to someone who understands the science. You have to go to someone who understands where in the skin these technologies are acting and what treatments are safe to put together. And when someone understands the science, then they know which treatments are going to complement each other and be safe to do in combination. So again, bottom line, we are going to do these treatments together, planning properly, utilizing science to know which ones are going to be most beneficial to do together and to maximize your time in the office. So we're going to choose treatments that have high patient satisfaction, improved overall results, low rates of serious complications, and that we know can be safely done same-day treatments. And of course, not every treatment should be done together. So here are some combos that we do together. Fraxel with Sculptra, Ultra Clear, our ablative fractional device with filler, Softwave with filler, and IPL with Ultra Clear. So these are all things that I do almost every day in combination. Let's go over some examples. So here's a patient of mine. We have done a combination treatment on him for his acne scarring. So he is partially through his treatment session. He is not complete with his treatment. But for him, we have done Sculptra, which is a biostimulator. It increases collagen growth. We have done Fraxel laser, which is a non-ablative erbium laser that smooths the surface of the skin. So we're doing two things that stimulate collagen with different mechanisms of action. And we do those two things to not only complement each other, but to be synergistic. And so we've got an overall more radiant appearance of his skin. In fact, look at on the right side, his pores on his upper cheek. You can see already his pores are smaller. That's only after 2 Fraxel treatments. And then of course, the area we're really looking at, which is kind of the outer cheek and his temples, you can see how much smoother that area is already. And he's only about halfway through his Fraxel treatments. So he's got the radiant appearance, reduced pores, great overall texture, and reduced scar appearance, of course. Okay, this is a patient of Dr. G's. So Dr. Grenenbaum, she did Ultra Clear, which is our ablative fractional erbium treatment on the face and neck. Then she did 2 biostimulators. So 2 treatments that are going to stimulate the patient's collagen. And they use different mechanisms of action to do so. So look at that change in her jawline and in her neck texture. Pretty darn good for a non-surgical result. So that is 2 months after treatment. Biostimulators and laser continue to work for at least 6 months. So this patient is currently getting more and more improvement as we speak. Well, speak of the devil, there she is, Dr. G. Dr. G is a huge believer in science, and she really wanted to have a multimodality treatment. So she did. Our nurse, Maya, treated Dr. G. And so her concerns were some sunspots, some melasma or hyperpigmentation. She wanted to brighten up her skin a little bit. And of course, we all want to help any sort of drooping that's occurring. So she had ultrasound done, focused ultrasound or soft wave on the face and neck. And she also, same day, had ultra clear on the face and neck. So look at her beautiful results. Look how brightly she's shining in the right-hand side. The skin texture and discoloration has improved and her skin is lifted. So look at the jawline. It's firmer there and her cheeks are lifted, her temples lifted. And like I said, jawline is a little stronger there. So this is only 1 month post-treatment, but she really wanted to be in the webinar today. So here are her preliminary results, and we're happy to update you on her full results in 5 more months. And she did this treatment very easily. She barely had any downtime. She went to work the very next day, no problems. Here's a patient of mine. So pay attention to this because this is one of the promos that we're going to be offering. This patient is a patient with a little bit more melanocytic heavy skin, so an Asian patient. She has had redness, some blotchiness, and some pigmentation, both sunspots and some melasma. So what we did, we started very slowly. We just alternated one treatment V-beam, one treatment IPL, very slowly. And very conservatively, because with the darker someone's skin is, the more conservative we have to be with the laser treatment. But we can do laser in patients with darker skin. It just requires more consideration and unfortunately more work for the patient with sun protection. But anyway, so we did 5 IPL treatments, 8 V beams. She just kept coming in for these treatments. We just did them one after another. Look at her beautiful skin, and she loves her skin now. She never wears makeup, only sunscreen. She says she always gets compliments on her skin, where previous to treatment, she never had any compliments on her skin. And so we're really, really proud of her. And it makes me happy because I feel like these treatments have had such an impact for her. Here's another patient. So he had soft wave and he had filler. So men often get these treatments. I love how it's destigmatized. He's very young to begin with, but you can see in the picture on the right-hand side, he's got rejuvenation of his skin from the soft wave. He's got a subtle lift in his cheeks from the soft wave, and he's got more support in the lateral cheeks or the outer cheeks from the filler. So the filler has supported his skin and he's gotten lift and brightening of the skin from the soft wave. So conversely, you don't have to do everything. In fact, I'm often telling my patients, we don't have to do a lot. The key is to just get started. And so even if you just get started, we don't have to have you constantly back in here doing these treatments. We can just get started with a couple things, and I will help guide you what's most appropriate, what's next, and what the frequency is. And it's often patients are surprised. Sometimes they're like, "Oh, you don't need to see me for 6 months." No, I don't, because you've started early, you're thinking preventatively, et cetera, et cetera. So everybody's different. And I really encourage you to come in and have a cosmetic consultation because it is my job, our job here in the office to help guide you both to tell you what's appropriate, what's safe, and not to overdo it. And we love making customized treatment plans for you. And we have a lot of tools here at the office. We're very lucky. We have a ton of lasers. We have a ton of energy-based devices. We're very proficient at the injectables. So we feel like we have those tools that will help you get your best results and a beautiful natural look that's right just for you. Okay, so let's go over the packages. Thank you very much for attending, and I am going to do a demo after we do these packages. You do not have to stick around for the demo. I just want you to see what the promos are, and you have till end of day tomorrow if you want to commit to these promos. So, first promo. Remember that patient I told you to pay attention to? So we're going to do that combination treatment for you. This is for patients who have skin that just seems duller over time, and they may have a little bit of ruddiness or redness or broken capillaries along the nose. So the V-beam laser helps with that. They may have a few sunspots or melasma, or they just want an easy way for their texture to be brighter. And so this package is also really great for patients who are kind of nervous about downtime because the downtime is very minimal for this. Now, I will tell you for any laser treatment, including this one, you need to be very, very, very careful with sun exposure 1 week before and 1 week after for a typical patient. And if someone has a little bit darker skin, then I'm going to give them additional sun precautions. So just keep that in mind. But these promos, once you commit, are good for a year. So you can treat in the fall. Or if you're avoiding the sun now because it's very hot out, it's a good time to do the treatments now. So you can do these all in one session, one IPL, one V-beam. And then what my favorite thing to do is to add a chemical peel, very mild chemical peel. So if you don't want to peel, and this is what we're going to do today, if you do not want to peel, then we just do something really, really light, and it makes your skin brighter almost immediately. And it basically helps exfoliate your skin without peeling. So the effects are microscopic. You have microscopic exfoliation. It's wonderful. You can do that all in one session. Then we're going to throw in a travel size Elastin Illuminate, which is a topical that has multiple botanicals, but it also has topical tranexamic acid in it, and it helps brighten the skin and help with ruddiness and brown spots on its own. So all these things together, it's worth $1,600. It's yours for $1,000. You're saving $600. This will work for almost everyone. In fact, I want to have this done. So I'm going to have to hit somebody up to do this treatment for me. But I'm going to be doing this for my model today, and you'll see how easy it is to do in office. And it's basically has no downtime for most patients. Okay, so that was package clear. This package package to clearer. And this is the same thing, series of 3. So if you're really serious to help your skin tone and pigmentation, it's going to take more than one treatment. So here's the series of 3, and we've tried to make it as affordable as possible. Again, this is something that's going to address both brown and red and skin texture. It's going to exfoliate, and you also get Alastin's newest product, which is the Restorative Skin Complex, which is a fabulous collagen or product that stimulates collagen. So highly, highly, highly recommend this if you know you want to work on your pigmentation over the next 3 to 6 months and you want something really impactful. This is going to be awesome. You have a full year to use these packages. Okay, and then for patients who want a little bit more texture-wise, or maybe you have some fine lines you wouldn't mind getting rid of. So this is one moderate ultra clear. In other words, this is our fractional ablative laser, and it's going to tighten around your eyes. It's going to tighten around your mouth. It will help with any crepiness, especially jowl area. And it really does a lot for skin texture. We're combining this with an IPL treatment, which really is going to augment or boost the skin texture, but also especially the brown spots. So it's going to be great for brown spots, great for texture. It's like a turbocharged package of the other ones. And you're doing more in one treatment. You will have a little bit of downtime with this. So this comes with about 1 week of downtime. First 3 days are pretty darn red and puffy. After that, it looks like a moderate sunburn for an additional 3 to 4 days. No sun for a week before, a week afterwards. This is a fantastic combination. I really hope you guys take advantage of this because it really helps the texture and the pores as well as the pigment. Okay, I'm going to pause and we're going to go to the laser room. We're going to journey on over there. And when we come back, I'm going to answer your questions as well as do an IPL, a V-beam, and a chemical peel for you. So I will see you in 1 minute. Thank you so Hi, everybody. Okay, sorry, it's probably a little loud because we've got the two lasers going, but this is Mary. Mary's on my team, and I decided this morning she would just be the perfect webinar candidate. So she's doing this kind of spontaneously. Thank you. And have you ever had a laser done here? No. She's never had a laser done. And I told her we were doing this, and she knows she's live on camera. So she's very brave and she's got a lot of trust. Thank you. So the first thing we're going to do is the V-beam treatment. So the V-beam is a laser that was specifically designed to treat redness. So it treats broken capillaries, rosacea, sun damage, it even treats scars, helps with acne, etc. Great treatment. So what we're going to do today, just for Mary's indication, is very early sun damage, a little bit of very, very mild rosacea, like even, it's just very mild. But again, prevention. Prevention is the way to go. We're going to keep her from getting red, and any redness that's there, we're going to treat. Okay, so here we go. I've already loaded in her settings. So I am just going to come over here. And I'm going to do a little test pulse. 1 second. I talked too long. All right. So this laser, Mary, is a little snappy. And it's like a little snap and then a tiny puff of air comes out to cool the skin. That's what makes it safe. And it goes very quickly. And that's really it. And in terms of downtime, there's really none. You're red for maybe like an hour, but most patients will go right back to work. I have this treatment all the time, like right before my clinic, and I look a little goofy for first patient, but after that, it's totally fine. So I'm going to do one test pulse right here. 1, 2, 3. Is that okay? First time ever getting laser. You're amazing. Okay, there, here we go. Incredible. Definitely really good. Okay. Amazing. She's so incredible. And guys, the results of the laser are awesome. I have patients who come in. Once you're on maintenance, I recommend once every 6 months. Patients who come in, they've been getting this laser for several years. They're just maintaining. But what happens after a while, their skin just starts to glow. It's not only more clear, it's glowing and becomes radiant because the more you do this, the better your quality will get, or the more new quality. So, cool. Got really, I like to call that a really good side of that. This laser is extremely effective. And very predictable. The only downside really is that rarely just one treatment. Occasionally patients are very, very pleased with one, but I always tell patients, what to do if your rosacea is bothering you or sun damage is bothering you, what to do 3 to 6. And then ideally, an ideal situation, you do one treatment every 6 months, and then your skin just starts to look better and better. I'm telling you, my patients who do this, they never get old. Their skin just glows. Right. So we are on the home stretch. On the next thing we're going to do is we're going to do the IPL. So IPL is not technically a laser. IPL stands for intense pulse light. And some of you may have heard of BBL as well. Same thing, just different brands, slightly different technology. Okay, we're done there. Great job. So we're going to switch to the IPL. So anyway, basically it's a light-based device, and I put a filter in it, and the filter filters out certain wavelengths of light and allows other wavelengths of light through it. So it basically allows the device to act like a laser, even though it's not technically a laser. And one of the points behind that is it's very versatile. So I can put in different filters to target different things, or different filters based on a patient's skin type, or if they've, have certain skin conditions, etc. So I'm going to switch device. I'm going to turn off this loud device. And because it's a different wavelength, we've got to change goggles. So switching goggles. That's the most, safety first is what I always say. So that's the one thing I'm always watching for. If we are doing 2 laser devices, imperative, patients have metal goggles, works for every wavelength. But for us, we have to change the goggles, the different wavelengths. So anyhow, we are switching to the IPL. Again, very, very easy to do. My patients who have been using the IPL, and for maintenance, my ideal maintenance is once every 6 months. If someone has been doing that with me, and I do have patients who've been doing it every 6 months for like 10 years, their skin is so amazing. It glows, it's radiant, doesn't have any brown spots. It's really, really beautiful. It's very effective. You don't have to do every 6 months, but if you do, the results just get better and better. So, in the settings here. Mary, have you put any direct sunlight recently in the last 2 weeks? Nothing directly on her face? Okay. So that's fabulous. She is such a good dermatology co-worker. Okay, so what's great about our IPL device is that the handpiece is very big. So I can do a full face very quickly, which is really nice for patients. And again, when we're doing multimodality, that's also very nice. So this device, Mary, is going to feel hot. It's less snappy, but it's just a tiny bit more heat than the other device, okay? So I'm going to do one pulse right here, 1, 2, 3. And was that okay? Mm-hmm. Okay, watching it. Oh, this is going to be really good. I see a few sunspots that are just pop right away. Okay, guys, so for downtime for this one, if you have some dark sunspots already, they will turn darker for about a week and then they will fall off. So some people say they look like coffee grounds. Other people say they look like Oreo cookie crumbs. But your first treatment, you might have some noticeable spots that get darker. Subsequent treatments, if you're doing them on the maintenance regimen, which is every 6 months, you're not going to have any downtime. Maybe if one pops up in 6 months that's pretty dark, maybe that one will be a little dark, but otherwise, there's just nothing to it. So the main challenge is in Arizona just staying out of the sun the week before, the week after. How you feeling? Not too bad? No, no. She's doing so great. Okay, here we go. I don't think you can see we're moving right along. This device also, by the way, will treat redness. It'll treat a little readiness. Some patients prefer it over the BB. The BB is more specific for red, but usually start with it. But if someone has brown and red, then I'll start with the IPL. Very excited. Great. Just about done. You can see she doesn't look like she's tortured. Excuse me, not bad for first treatment. First part of this laser is let I get the gel all over me. All right. Go. Looks good. Sometimes I'll go back and get brown spot again. And it's my allergies. Pretty late. Okay, so that is done. So, device is on standby. Oh, we can take off our glasses. All right, so she did amazing. First time. She just did 2 lasers, first time. Now, the icing on the cake, so to speak, because this little gentle chemical peel is going to be like the final touch of her glow up. Excuse me. And it will be immediate. So, for Mary, and with chemical peels, one of the great things about chemical peels is that we can be very, very versatile. And I chose for her something called a trichloroacetic acid chemical peel or TCA chemical peel. And we're going to do just a very mild one. And it's going to give her a little bit of tightening. Not know why we just poured so much in there. We might have to all have chemical peels after this. Might not be a bad idea. So, anyway, distract myself. Anyway, trichloroacetic acid, it's very gentle, but she is going to get some tightening around her eyes and tightening around her mouth. I chose this one specifically for that purpose. Also, like I said, it's just going to exfoliate and make everything look great. Let me just adjust this a little bit. Okay, so Mary, have you had a chemical peel before?
No, I haven't.
Oh my gosh, this is awesome. Okay, first time for all these things.
Mhm.
So, and you know what, Reagan, would you mind if I do a little tiny bit of liquid nitrogen here too? Mary,
I'm good.
Is that okay?
Yeah.
It might scab just a little bit. Okay, so I can't help myself sometimes. This little spot is like a genetic spot, and so the laser will lighten it, but it won't remove it. So oftentimes I'll pull out the liquid nitrogen for patients and we'll just zap it while we're in here. And that way it'll just fall off in a week. So basically for this, what you're going to do is just relax, but you'll feel hot. Okay. You'll feel a little heat, and that will last maybe like 2-3 minutes. And the heat will probably be like a 3 or a 4 out of 10. So it's not going to be super intense. but you go from feeling nothing to that 3 or 4 pretty quickly. So just FYI. You can give me my glasses, please. Sorry, guys, these allergies keep making me cough. Okay, so here we go. And did you do alcohol over the top? You did this thing. We're doing this. You should be good. All right, we're good. One thing we do is we just make sure there's no moisture on the skin before we do this. Otherwise, the peel won't work effectively. So unfortunately, we take off all the moisture and then we put it back in after we're done. Okay, so here we go. Okay, so you just feel like liquid. That's all it is. Liquid going on. And, everybody wants a little more tightening here and a little more tightening here on your lids. So we're going to go for that. Okay. This will also help pore size. And I'm really going to go around your mouth too. And again, it's not going to peel, but it's going to just be enough where it's doing a little something. Beautiful. You feel okay? Mm-hmm. Awesome. Feel great. Amazing. Oh, and you're gonna have a great reaction because these little tiny sunspots, I didn't even notice them on you before, but these tiny sunspots have just popped out, which is a good sign. And those are gonna go away very easily. And even your little blood vessels here, I see them. They're kind of purplish now, and that means we've got them good. Great. Oh, this is gonna be so good. Great. Amazing. And you guys, when you are so busy in your lives, come in here and this doesn't even take as much time as you would think it would take. And we just did 3 different treatment modalities targeting 3 different things, probably more than 3 different things, to be honest. Yeah, it's going to be so good. And these changes are going to be synergistic. She's going to be so happy. Okay, there we go, guys. The end. She did amazing. And oh, do we have any questions? Let's check. We're going to check for questions, guys. Thank you so much for attending. You're going to slide. Just going to be like a little stinging sensation. 1, 2, 3. Any questions?
Somebody asked, what is the difference between ultra clear CO2 and Fraxel, and what do you recommend for 45 and older?
Okay, great question, guys. So for CO2, I assume you mean what we call traditional CO2, and that's a fully ablative laser. And that's when the skin, the whole top layer of the skin is basically removed and then kind of turns you into a burn victim for a few weeks. Great treatment, very painful recovery, and very risky. So we don't do that anymore at our office. Most people who do it are taking patients into an OR. So like a lot of plastic surgeons will do it same time as a facelift. It's the best way to treat wrinkles, but also the highest risk, which is why we don't do it anymore, because we have safer things we can offer, but it just may take more than one treatment. And you're done, Mary. Good job.
And then somebody asked, what's the difference between laser treatments and chemical peels?
Okay, let me answer that. Let me go back to the previous question. So then we have the Fraxel and we have the ultra clear treatment. So the Fraxel is a non-ablative erbium, meaning it's very gentle. The heat doesn't get as intense. And yes, we can go ahead and the heat doesn't get as intense, but it's still very effective with collagen stimulation. So pore size resurfacing, meaning skin tone and texture improve, and fine lines, wrinkles, etc. And then a step above that would be the ultra clear, which is a fractional ablative erbium. So very similar to CO2, except fractional. And that means the laser is going to produce more heat within the skin. And the results are going to be amplified basically. So you can get more results per treatment for most cases. You can't generalize that completely, but for most cases, especially anti-aging cases, more results per treatment. But the downtime's tiny bit more intense, but really not dramatically so. So that's the difference between the ultra clear and the Fraxel. Now, chemical peels and laser. So chemical peels are a form of resurfacing. And in fact, if we did a strong chemical peel, we would be doing the same thing as an aggressive laser, even as aggressive as a CO2 laser in some cases. But because we have the lasers, it's extremely rare to do that aggressive of a treatment because the chemical peels are less reliable than a laser. With the laser, we dial in the settings. I know exactly what depth I'm going. I can alter it. If I'm treating a scar, I alter it for that. If I'm treating a different area of the face, I alter the settings for that. And the lasers are extremely precise. So that's an advantage. It's advantage for safety and for reproducibility of your results. Um, so you'll see that in general, the field has evolved to using very mild chemical peels, and that's what we do in our office. So we do mild chemical peels. It's kind of a different mechanism of action, but it's a very mild form of resurfacing. So it helps with collagen stimulation, exfoliation, brown spots, etc. But again, you can, in our office, you can think of chemical peels as being more mild and lasers being a little bit more aggressive and having a little bit more results per treatment.
And then last question, somebody asked what's the difference between ultra clear and V-beam?
So ultra clear is what we call resurfacing. So resurfacing means basically we're taking the surface, like think of the paint on the house. We're taking the surface and we're sanding off the old paint and we're putting on new paint. So it's kind of like aggressive exfoliation. The heat produces collagen, so all the good things that come with that. So that means smaller pore size, glowier skin, a little bit of tightness in, so in the ultra clear specifically, it tightens the skin. So it's really good for lines around the mouth. It's really good for the jowl area, slows down aging. Whereas the V beam, it really focuses on the redness. The ultra clear doesn't do that. It does tightening in general, but it's colorblind. Whereas the V beam really focuses on the red, and you get a little bit of collagen rejuvenation just from a good side effect. So the more V beams you do, the better your skin looks, but it's subtle. Each treatment you get a little bit more improvement. But what's not subtle is improvement in the redness. So if you have redness, that's the primary thing that bothers you, then you're going to choose a V beam. If you kind of want to once over, you've got some brownness and some redness from sun damage, not necessarily rosacea or broken capillaries, but just that readiness from sun damage, then you want a resurfacing like ultra clear. So thank you guys so much for joining us. And please let us know if you are interested in any of those promos. You have until tomorrow, end of day, and we will send a follow-up email as well. Thank you so much. See you next time.